Never before have we had managed care organizations in the same room with healthcare organizations, with social service organizations, with people who are dedicated to health equity, trying to figure out what this really looks like for our populations that we're trying to serve.
King County spends roughly $35 million on about 1,200 individuals. And most of that money, 87% of it, is going to the crisis response and criminal justice systems.
We want to bring together partners that are looking at housing. We want to bring together partners that are looking at transportation. We want to bring together people who are focused on built environment.
I've seen individuals that have been on the streets for over 5 years just surviving off of panhandling and food programs.
And the vision of the plan was to basically work with a population that's highly vulnerable. Then we'll be able to improve health outcomes and reduce disparities for other populations as well.
We give them a voice. We can see where their challenges are and we can advocate on their behalf.
So that we can look at bettering the health of not just an individual, but an entire population.
And we have a lot of really exciting partners at the table: criminal justice partners, managed care organizations.
It really includes pulling together organizations who are focused on healthcare and focused on social services.
Part of the goals of the Familiar Faces is to stop individuals from going in and out of the systems, in and out of jail frequently, and instead providing them with services such as housing, employment, getting benefits turned on, and just building relationships with them to try to help them meet their goals.
But also meet the client and the person they're trying to serve where they're at.
We don't just come out and say, hey, we're case managers, we're gonna fix your life. Sometimes we'll even just bring somebody a cup of coffee and wake them up in the morning just to see how they're doing. And
we're better able to learn their stories.
So one of my clients, it took about a month of me just going to go see where he wakes up every day. And that really meant a lot to him. He goes, you know where I sleep, you know where I am every single morning, and you bring me coffee. And that moved him from me meeting on the street to him coming to this office. Long story short, within 2 months, we've already signed his housing paperwork. We've got him meds, and and an ID. These are things he hasn't had in 17 years.
Everybody wins in this, and we see greater outcomes because we're able to address the whole person.
And we want to solve challenges not just obviously for individuals, but we want to solve challenges for communities that we know are consistently underserved and overburdened.
And to understand the stories of the familiar faces to prevent new familiar faces from happening.
To walk down the street and have a client walk up to you and just say hi and welcome you into their world, and we could be that positive person for them. It means a lot to them.